The diaphragm muscle is the primary muscle of respiration, but it is so much more than that. It is so responsible for health and well-being and can help get you out of pain. So let's talk a bit about where and what this diaphragm muscle is and how to perform diaphragmatic breathing. The diaphragm muscle splits the torso into two cavities: your thoracic cavity, where your heart and lungs abide, and your abdominal cavity, where your organs are. And it's shaped like a jellyfish. So imagine a big jellyfish with then the tentacles coming down, or perhaps you like the imagery of a parachute, and the diaphragm helps communication between these two halves of our body. When you inhale, the diaphragm contracts and drops down and compresses and massages the abdominal organs. And that massage is so important for the health and functioning of your stomach and liver and colon and small intestine. So that dropping down, that inhalation, contraction, drop down of the diaphragm improves digestion. It drops down on the inhalation, creating a negative pressure, pulling in oxygen to the lungs. So the diaphragm muscle, breathing diaphragmatically, increases oxygenation to your body. In fact, this is really important. When you breathe diaphragmatically, as opposed to intercostally, just chest breathing, you improve oxygenation by 10 times the volume. That's a huge amount of oxygen that supports life in your body by breathing diaphragmatically, as opposed to a more shallow chest breath. So that's one way we get out of pain. We improve the oxygenation and we improve the detoxification in our tissues. When also, speaking of detoxification, when you inhale fully and the diaphragm drops down, it also massages the lymphatics in the abdominal cavity. That's the highest, that's where most of our lymph nodes, lymph vessels are found, is in that abdominal area. So breathing diaphragmatically improves lymphatics, which is your detoxification in your body. It decreases inflammation. So now we got reason level, we're on number 2. So we've enhanced oxygenation by 10 times the volume. We've improved lymph flow, lymphatics, detoxification, decreasing inflammation. Thirdly, and really, really, really important, is that the diaphragm muscle is connected to the autonomic nervous system, specifically the parasympathetic. So let's start over. The autonomic nervous system is split into two halves. The parasympathetic nervous system, your rest and digest aspect, and the sympathetic nervous system, your fight or flight. So we want, in an ideal world, our sympathetics and parasympathetics to be balanced. But in today's world, in this crazy, stressed out, high-paced world with things going on as they are in this world, we tend to have an imbalance, and we're a little more sympathetically driven. And I will talk on another video of how that actually increases cervical and thoracic pain. But have a little bit more sympathetic overdrive, a little higher cortisol. It changes all the systems in your body, endocrine systems, hormones, when there's this imbalance. But we have some control. That's the best part. Breathing diaphragmatically can enhance your parasympathetic nervous system. You can have control in bringing your autonomics back into balance. In fact, Herbert Benson of Harvard Medical had a study many years ago that showed that breathing diaphragmatically for 20 minutes a day for 1 month changed the neuropeptide serotonin levels completely in the brain and the intestines, equal to that of antidepressants. So you can change the state of your neurology, you can change the state of your digestion, that you can improve sleep and just by breathing diaphragmatically. So it's kind of a big player. We've got nervous system, sympathetic nervous system, we've got blood flow, we got oxygenation, we got lymphatics. Okay, let's talk about how to breathe diaphragmatically. So perhaps we should start with what's not breathing diaphragmatically. If you put a hand on your chest and a hand on your abdomen, and you take a deep breath in, and your chest moves first and fast, and your belly goes in, that's the opposite of ideal breathing. So if I do this, that's chest breathing, and that is not engaging, that is not utilizing the diaphragm muscle. So let's talk how to breathe diaphragmatically. So I would want my bottom hand to move first and to move more than my top hand during the inhalation. So I will breathe out fully and then breathe in and feel as the diaphragm drops down, the belly swells slightly. Don't push the belly out, don't force it out. In fact, drop the hand on the chest and just put your hand above your belly button and breathe in naturally. Just a nice slow full breath. Breathe in. You should feel the belly move into your hand gently. If you don't, okay, we're gonna fake it till you make it. So try to feel the belly breathe into your hand. Almost like you're just giving a slight push out until you can feel that. That's the diaphragm dropping down against those organs, pushing that belly out. And then when you exhale, you should feel the belly move back in, pushing the carbon dioxide out of the lungs. So breathing in, the diaphragm contracts, the belly moves out. Breathing out, the diaphragm moves back in and up, pushing the carbon dioxide out. You want to feel the opening, the expansion of your abdomen when you inhale. For some of you, it'll be helpful to really feel the full excursion, the full use of that diaphragm by placing your hands on your lower rib cage, kind of to the front and sides of your ribs, because when we breathe in, the rib cage should slightly open, slightly expand. So when you breathe in, see if you can feel the rib cage move into your hands. And then when you exhale, feel the rib cage move in towards your core. And go ahead and give a little overpressure with your hands. Push against your ribs during your exhalation, hold it there, and then breathe back in to your hands in your inhalation. So that little bit of overpressure into your ribs will really help you tap into feeling that diaphragm. As you inhale, you'll feel that rib cage open, then you can go, oh, there it is, and then drop into that. So breathe in, the rib opens slightly, the belly opens slightly. Exhale, the belly moves inward towards your back of your spine, and continue with that. Now, it's one thing to feel the diaphragm excursion, then we want to train it. Like Herbert Benson said, Harvard Medical, we want to breathe diaphragmatically for 20 minutes. So in an ideal world, we would breathe with an inhalation equal to the length of our exhalation, or vice versa. We would inhale for a count of 4, exhale for a count of 4. Inhale, perhaps for some of you, just for a count of 3, and exhale for a count of 3. So in everyday workings of our life, we want to have even inhalation and exhalation. However, some of us need to jumpstart our parasympathetics. We need to improve our rest and digestion and decrease the amount of anxiety and cortisol and sympathetic drive in our system. To do that, you would inhale for a certain count, say 3, and you would exhale for twice as long, so 6. Inhale for 4, exhale for 8. To do that, I recommend breathing out through pursed lips, like you're breathing out through a straw, because that helps slow that exhalation down. So I'm gonna breathe in for 4 and exhale for 8 now. So remember, shoulders move away from one another and they're soft the whole time. They're not shrugging up. So I breathe in, exhale for 8, and then breathe normally. Inhale and exhale normally so you don't get lightheaded. And then after a few rounds of normal breath, you can inhale for 4, exhale for 8. Or for some of you, inhale for 3, exhale for 6. If counting feels too much while you're trying to reconnect to your diaphragm, you could use imagery. You could breathe in from the base of your spine. Place your awareness in the base of your spine. Breathe in through your central canal to the top of your head, and then breathe out down to the base of the spine. So you could practice breathing in from the base of the spine to the crown of the head, breathing out from the crown of the head to the base of the spine. When you want to double that exhalation and jumpstart your parasympathetics, breathe in from the base of your spine to the top of your head, breathe out from the top of your head all the way down to your feet. So that's just a way that you don't have to focus on counting, but you will still lengthen your exhalation by twice as long and hopefully help reset that autonomic nervous system, help jumpstart your parasympathetics, improve your sleep, improve your digestion, improve the state of your health and well-being. So I think I've given you enough reasons to practice diaphragmatic breathing, but it really, really, really will help get you out of pain, and it will also give you more energy and you will feel better. So good luck.